The current system is a waiting time driven system, for better or for worse. People consider that fair. But because the list has gotten so long, waiting time is enormous now. So people wait 5 or more years now for a kidney transplant. And what that does is transplant the person that's waited the longest. And one of the questions was that our goal? Was that what we intended to do? Really, it's a war of attrition of people who can survive long enough on dialysis to get the transplant. And many people, almost 20 every day, die on the waiting list for a transplant. And so when we thought about that, we said, well, how can we improve upon that? And one of the shortcomings of the current system is that if you're 80 years old and you're on the list and you probably have a life expectancy of only a few years, if you're at the top of the list, you get the next kidney no matter who the donor is, if it's a 20-year-old donor. And what we realize is there are a lot of mismatches both ways in the longevity of a kidney, in the longevity of a recipient. And we make no attempt in the current system to match those things. And so we worked a lot to try to figure out better ways to match longevity of a kidney. And it's a problem the other way, of course, too, is if you're 20 years old and you get an 80-year-old kidney, you'll probably outlive that kidney and need a second, third, or fourth transplant. And there are many people on the wait list now waiting for a repeat transplant. Almost 15% of the list is coming back for a repeat transplant.